Okay, so we are live now. Welcome to Diabetes Darbar. This session will be in English. Okay, so if you have any question, you're most welcome to ask. And only members of this YouTube channel will be able to ask questions. If you are not yet a member, you are most welcome to join this channel as a member and you will be able to ask me any questions. We have taken some questions from our previous videos, some comments we have. I'll ask Navnita to ask me those questions and I'll try to address to the best of my knowledge. Okay.
Good evening, doctor.
Hi, good evening.
Yes. Doctor, shall we start with the first question?
Yeah, please. Please.
Okay. Mrs. Shetty is asking, can type 1 and type 2 diabetes both can be chronic?
So, yes, it is a chronic disorder. Type 1 is definitely a chronic disorder because once you have type 1 diabetes, it cannot be reversed. You will have it for lifelong. Okay. And as far as type 2 diabetes is concerned, the definition in our medical books is that it is a chronic progressive disorder. But actually, this definition is incorrect because if it was chronic or progressive, then nobody in this world could have reversed their diabetes. Okay, I have reversed my diabetes within a year, and thousands of people are reversing their diabetes not even a year, but within months, within few months, within 3 months, within 6 months. So it is not a chronic progressive disorder. The definition of type 2 diabetes needs to be changed. And sorry, according to me, it should be a dietary disorder. It's a dietary disorder. Or you can say uh, it's a lifestyle disorder. Okay, it's a lifestyle disorder, it's a dietary disorder, and it can be reversed through lifestyle modification. It is not a chronic disorder. Type 1 is, however, a chronic disorder because once you have type 1 diabetes, which means your body is not producing enough insulin, your beta cells are destroyed, exhausted. As a result, your body is not producing enough insulin. And this is why you are having diabetes, which is called as type 1. And it's definitely a chronic disorder because you cannot reverse it. So am I clear? Type 1 diabetes is yes, it's a chronic disorder. Type 2 diabetes is not a chronic disorder. The definition in medical books needs to be changed. It should be a it should be a lifestyle disorder. It should be a dietary disorder which can be reversed through intensive sorry, I'm sorry, my voice is breaking. It should be reversed through intensive uh, lifestyle modification. Okay, several people have, thousands of people have reversed their diabetes, and it is not a chronic progressive disorder, which most of the doctors have been taught or they are practicing. We need to change this. Okay. Okay, next question, please.
Next question is, what are the chances of cardiac arrest in diabetes?
Yes. See, if you have diabetes, it can lead to several comorbid condition. One of them is hypertension and uh, fatty liver, kidney disease. All this together can lead to cardiac arrest. Okay, the most important factor for cardiac arrest or heart attack is insulin resistance. Insulin resistance can thicken your blood vessels. As a result, the blood vessels will get constricted, blood flow will be obstructed, and this is the reason for the cardiac arrest or heart attack, what we say. So, insulin resistance leads to diabetes, and because of this, you can have heart attack. So, how to prevent it? So, it's very simple. It's very simple. If there is you need to find the root cause. The root cause is insulin resistance. So, you need to treat insulin resistance. how can you treat insulin resistance? So first you need to understand what is insulin resistance. Insulin resistance is nothing but when your body is producing enough insulin, but the insulin is not performing its job or not able to do the job which it is intended to do, and the job is to drive the glucose into your cells. Okay, so I'm not going very deep into this. I'll just elaborate or give you in a very simple language that um, to get rid of insulin resistance, you need to follow a proper diet, and the diet which I recommend is DIAAFIT diet. What is DIAAFIT diet? It's nothing but you need to restrict your carbohydrate. The carbohydrate which we recommend is, firstly, you need to calculate your total daily energy expenditure, which in short form is known as TDEE. And out of those calories, that is the total calories, you need to take less than 26% from carbohydrate. Okay, so when you take less than 26%, there is 100% of your total you need to complete 100%, right? So 26% needs to come from your carbohydrate. 25 to 30% you can take it from protein, and if you calculate, that will be like 1.5 to 2.5 gram per kg body weight. You can go up to 40% also by protein. If you want to increase the protein intake, that's absolutely fine. If you're an obese or overweight category, then you need to consume more protein to reduce your weight, and the rest of the calories can come from healthy fat. So if you follow this, plus along with this, you need to do strength training. Okay, so along with that strength training, good sleep, reduction of stress, you will be able uh, to overcome insulin resistance. When you will reduce insulin resistance, when your body will be insulin sensitive, then the chances or the risk of getting cardiovascular disease will be minimized. Okay, so it is, yes, highly related. If you have diabetes, so you can have cardiac arrest or heart attack.
Next question is from Miss Kiran. Can diabetes patient gain weight? I have lost almost 4 kgs.
uh, can diabetes patient?
Patient gain weight. She has lost 4 kgs after being diagnosed with diabetes.
Okay, so I don't know whether she is type 1 or type 2. I don't know what is her fasting insulin, what is a C peptide. But if she is diagnosed with type 1, yes, the weight loss will happen. Even in case of type 2 patients, there can be weight loss. Initially, in most of the patients, weight loss doesn't happen. Uh, Initially, there will be weight gain. Why weight gain happens? Because there is insulin resistance. There is hyperinsulinemia. When I say hyperinsulinemia, it means that your body will produce more insulin. Okay, and insulin is an anabolic hormone. Is insulin is a fat storing hormone. So as a result, your body will store fat and you will gain weight. This is the first step in most of the cases. But slowly and gradually, what happens is, because of the insulin resistance for a longer duration, uh, your body starts burning fat cells, and this is how you start losing weight. Okay, so if you are losing weight, this could be one of the reason that you were insulin resistant for quite a long time and you did not check. Suddenly you checked, you were diabetic, and then you started losing weight. This could be one reason. Another reason could be that you are type 1 diabetic. That's why you are losing weight. Your body is not producing enough insulin. Third reason could be that once you are diagnosed with diabetes, what most of the people do, they start more of walk, jogging, and they stop eating food. Uh, they stop eating much carbohydrate. So as a result, there's water loss, there's muscle loss, there's fat loss. This is how you lose weight. Okay. So this is about it. I think there's one question out here. Just let me take this. Please say about high protein or high protein. See, high protein is something when you take more than 3 gram per kg body weight or 3.2 gram per kg body weight, that is high protein. What we recommend in DIAAFIT is 1.5 to 2.5 gram per kg body weight. This is the optimum amount. What other people, other organization they recommend is 0.8 to 1 gram per kg body weight. This is the minimum which you need to take. This is not the optimum. This understand, this one is minimum, one is optimum, and one is maximum. Optimum is 0.8, sorry, minimum is 0.8 to 1 gram. This much you need, but this is not the optimum. This is the bare minimum. Optimum is 1.5 to 2.5 per kg body weight. Okay. And the maximum could be more than 3 gram per kg body weight. So we don't recommend anybody to take maximum protein or minimum protein. We recommend the optimum protein. However, if you have any kind of kidney disease, if you have already kidney disease because of diabetes or for any other reason, then you cannot take 1.5 to 2.5. That much is not required for you. You cannot digest. Your body will not be able to handle. Your kidney will not be able to filter so much of protein. In that case, you need to take the minimum amount of protein which is required. That is 0.8 to 1 gram per kg body weight. Or maybe if you have already reached end stage renal disease, then in that case, sometimes we even recommend 0.6, 0.7 gram per kg body weight. Okay. मेरा fasting 120 आसपास रहता है. Okay, that's fine. That's nothing to worry. Nothing to worry about fasting. Don't check your fasting blood glucose. That's not a very important parameter because it can be misleading. Okay. Anything else?
Doctor, patient Sana wants to know about ketoacidosis. What is fluid retention?
Okay. So fluid retention is nothing but when your body retains fluid. Okay, you have excess fluid in your body. That is fluid retention. Another question was, what is ketoacidosis? So let's understand. There are two terminologies. Okay, one is ketoacidosis, one is nutritional ketosis. In both the condition, your body will release ketones. Okay, there are three types of ketones. I'm not going to talk about those, but your body will release ketones in two conditions. One condition is nutritional ketosis, which is absolutely different from diabetes ketoacidosis, which the patient asked. So diabetes ketoacidosis means you have insulin resistance, you have diabetes for long year, and finally your body is not able to uh, convert glucose into energy. Okay, glucose is nothing but a source of energy. We have three types of macronutrients: protein, carbohydrate, and fat. These are the three macronutrients. Okay, uh, carbohydrate is nothing. Carbohydrate has no role except to provide energy. Okay, protein has different roles for, like, it is a muscle building uh, uh, element. It is a part of your skin, it is a part of your hair, your nails, everything. So without protein, it is very difficult. Your body cannot function. uh, Fats also is very essential for your body because your body needs fat to make different kind of hormones. There are different hormones, right? So many hormones are there. All hormones need fat. Without fat, your body cannot produce hormones. Okay, Navnita, let me ask you one question. Have you heard of essential fatty acid?
Yes, doctor.
So there are two types of essential fatty acid.
Hmm.
That is omega 3 and omega 6 fatty acid. Okay. Have you heard of essential amino acid?
Yes, doctor. Long time
There are,
back when studying.
yeah, there are 9 essential amino acids.
Hmm.
Okay. Have you heard of essential carbohydrate?
No, no.
Just
No,
Google
doctor.
and
Can you
just Google
explain?
just Google and see. Can you find essential amino
No, no.
carbohydrate?
No,
This
doctor.
there is no essential. Please Google. I request all the people who are watching me now. Please see essential amino acid in Google and see. You'll find there are essential amino acid. There are 9 essential amino acids. There are 2 essential fatty acids. You just Google right now and type essential carbohydrate. Okay, or essential glucose. Okay, there are no glucose is the smallest unit, glycogen is the smallest unit of carbohydrate. Essential glycogen. Just search and see if you can find it. You will not find. You will not find. Now let's understand what does essential means. Your body is capable of making amino acid. Your body is capable of making fatty acid. Your body is capable of making glycogen. Okay, these are the 3 units of 3 macronutrients, and your body is capable to make all these 3 smaller units. When I say essential amino acid, means there are 9 essential amino acids which cannot be made by your body. Your body cannot produce, your body cannot make those 9 essential amino acids. That's why you need to take it from outside. Similarly, your body cannot make two fatty acid, omega 3 and omega 6, which needs to be consumed from outside. That's why we call it essential amino acids, essential fatty acids. However, your body can produce glycogen all the time. Okay, even glycogen can be produced from protein itself. Usually, you know that glycogen is produced from carbohydrate, but if carbohydrate is not there and you are eating enough of protein, your body can produce glycogen from protein. So there is no such thing as essential glycogen, essential carbohydrate. That's why carbohydrate is not required by your body. However, 5%, only 5% of uh, carbohydrate or glycogen is required by your brain cells. Your brain cells, there are certain brain cells which cannot function without glucose, without glycogen. And that's why some amount of glucose is required. But you don't need to consume it from outside because your body can produce it. Whatever amount is required by the brain cells, that much can be produced by your body. Okay. Now, coming to the question, what is diabetic ketoacidosis? When your body is not able to produce or not able to utilize glycogen as the source of energy. So there are a lot of glucose in the body, but your body is not able to convert it into glycogen because there's an obstruction, because your cells are, uh, you know, uh, your visceras are, what to say, stuck with fat. Insulin is not able to perform properly. It is insulin resistance is there. As a result, your body starts burning fat cells. When the fat cells in your body starts burning, then a substance called ketone is released. Ketone is also a source of energy. Your body needs energy to function. Like I'm moving my hand, I need energy for that, right? So now, if I'm insulin resistant, my body is not able to convert carbohydrate to glycogen. So what it does is it converts fat into ketones, and that's how I get the energy. And this is called diabetic ketoacidosis. It is a very dangerous condition because there is lot of glucose, there is lot of ketones as well. When there is lot of ketones and lot of uh, glucose, this is called diabetic ketoacidosis, and it is a very dangerous situation. How is it different from nutritional ketosis? So nutritional ketosis you can reach by following a very low carb diet, a keto diet, intermittent fasting, prolonged fasting. Uh, you can follow that. When you follow that, then your body is already depleted of glycogen, and your body releases ketones to provide you the energy. So the difference is, in this case, in the nutritional ketosis phase, your body produces more ketones and there is minimal or no glycogen at all. As a result, uh, it's not a dangerous situation. It is an ideal situation to lose weight, to reverse your diabetes, and to bring your body to the sensitive stage for the insulin. Okay, I hope I have answered this clearly. Okay, so there are so many things which you need to follow. Okay, so any other question? Please ask all your question in English only. This session is in English. We will have a Hindi session as well very soon. Okay, but this session is only in English. So please ask your question only in English. Thank you. Okay.
Doctor,
And
next question. Can type 1 diabetes lead to liver diseases?
as I already mentioned that if you have diabetes, it can lead to many comorbidities. Liver disease is one of them. Okay, so you need to follow DIAAFIT diet, restrict your carbohydrate, and this is the only way by which you can prevent it. Yes, it is preventable, but if you don't follow a proper diet, you don't follow DIAAFIT diet, if you don't exercise, if you don't sleep properly, then it can definitely lead to liver disease. Okay, anything else?
One more question. I want a medicine-free life. I am diabetic since 2 years.
Yeah. So what is the question?
She wants a medicine-free life.
Okay, watch all my videos, reverse your diabetes. If you can't reverse your diabetes yourself, you are most welcome to join our coaching program below the number, below mentioned number. You can call and join our coaching program. We will help you to lead a medicine free life. I am leading a medicine free life for almost 8 years now. In fact, I have taken medicine only for 15 days. I was diabetic 8 years back in 2017. Okay, almost 8 years, 9 years. It will be 9 years, I think. Okay, so I'm leading a medicine free life. You too can lead a medicine free life. Watch all my videos. If you can't reverse your diabetes yourself, then you're most welcome to join our coaching program. Please call at this number and Navnita will help you about our coaching program.
Can diabetes cause depression?
Oh, yes, of course. I was depressed for almost 5 days, five to 10 days. When I saw my report, immediately I went under depression. I could not sleep for 5 to 10 days. I had sleepless nights. I could not eat properly. I had suicidal tendencies. There's so many thoughts which were coming in my mind. And I hope, Navnita, you remember when I was diagnosed, I consulted you also for diet because I was not aware of diet because I was a medical doctor and I had zero knowledge about diet. So that time I contacted Navnita also to guide me. Uh, but diabetes reversal is not something which we were taught, and we were taught only about nutrition, how to eat, what to eat, when to eat. But nowhere the concept of diabetes reversal is there. And this is how I did my own research and came about diabetes reversal. And now I'm helping thousands of people reverse their diabetes. Okay, so but yes, whenever somebody is diagnosed with diabetes, they have different kinds of thought, and many go to depression because they feel that they cannot eat anything. They cannot eat anything. They have to stop everything. They have to stop all their favorite dishes. It is not like that. It is not like that. Maybe for a year or so, you need to stop some of your favorite items, but once you reverse your diabetes, you can eat everything. And this is what we teach. This is what we guide. This is how our program works. We teach you first how to reverse your diabetes and then how you can eat everything. So diapit diet is such a beautiful concept where you can eat everything and still control your diabetes and reverse your diabetes as well. So you need to understand the concept of diet and nutrition, diapit diet. If you don't understand, then please join a coaching program. Please join our coaching program immediately. Don't waste your time. You can only reverse your diabetes as long as your body is producing insulin. And it is very easy to reverse your diabetes when you are initially diagnosed. If you have diabetes for 10 years, 15 years, 20 years, it becomes very difficult. I'm not saying impossible, but it becomes extremely, extremely difficult to reverse your diabetes. So, initial stage, it is very easy to reverse your diabetes. So please reverse your diabetes, okay? And diabetes leads to depression, okay? And then I have seen many diabetic people, there's not only start anti-diabetic drug, they also take medicines for blood pressure, and at the same time they take medicine for depression as well, anxiety, to control the anxiety, okay? And then they can't sleep, then they have anti-sleep drugs also. the, you know, I have seen patients taking 15 medicines, 17 medicines for different conditions. Because one medicine, because anti-diabetic drugs will work only to reduce your blood sugar. Then you have some fatty liver problem, there are drugs for fatty liver. Then your uh, cholesterol is high, you have statins for that. Then your blood pressure is high, then you initially you're given one drug, then it doesn't work, then you take two drugs, three drugs, like that. Then you have depression, you take medicine for depression. Then you have sleepless nights, another medicine. So I have seen people with diabetes taking 17 drugs, and I ask them, what do you eat, sir? We just eat medicine. And they are not eating food, they're not eating proper food. Okay, what food they are eating? They're eating dalia, upma, millets, ragi, bajra, fruits, dal, idli, dosa, and taking 17 medicines. So this is where the whole concept is getting wrong. And this is how we teach people. Slowly and gradually, when they join our program, we stop most of their medicine one by one, step by step. Mind you, diabetes reversal is a long process. There are so many organizations who have come now, and they will promote their program that we will reverse your diabetes in 3 months. Diabetes reversal doesn't happen in 3 months. And I'll tell you, if any organization, if any company sells any kind of products, and they tell you that without these products you cannot reverse your diabetes, they are just here to mint money and nothing else. No particular product is required for diabetes reversal. Everything is available at your home. Only thing which you need is some kind of you need to replace your atta or something like that. You need to buy some supplements, that's it. Otherwise, if they say if you don't buy our products, then you will not be able to reverse your diabetes, then please move out of those programs. Don't listen to them. There are thousands of companies now who are promoting their products and they are promoting diabetes reversal. You will just lose your money and nothing else. You don't need a single product for diabetes reversal. Okay, you don't need a single, I'm repeating myself, you don't need a single product. That's why we don't sell any product in our thing. We just give consultations, we give a diet chart, and everything needs to be quantified, everything needs to be customized, everything needs to be individualized. This is called quantified nutrition, this is called precision nutrition. You need to know what you need to eat, when you need to eat, how you need to eat. That's it. Once you understand this concept, then you don't need any other product. Okay, that's it. Depression is very common. Any other question?
Is chronic diabetes reversed?
I think I answered this. No? Diabetes is
Again,
chronic.
same question I got.
Repetition, yeah. So diabetes is a chronic thing. Type 1, type 2 is not a chronic disorder, it is a lifestyle disorder, and yes, it can be reversed. Okay, the similar question.
Hmm.
I've already answered that. Okay, anything else?
During summer, I don't crave for food. This is from Mr. Samir. So I don't want. I want to eat less. So do you have such dietary option?
See, what is the concept? DIAAFIT diet is a concept. Please understand what do we teach in DIAAFIT. Firstly, we say eat whenever you are hungry. Then we say when you are hungry, follow DIAAFIT diet. So if you're not hungry, you don't need to eat. Second thing is we don't need to see your watch and eat like breakfast, lunch, and dinner. We don't have any concept of breakfast, lunch, and dinner. In our system, we say first meal, second meal, third meal. So Navnita, for you, say let's say breakfast. When I say breakfast, what do you understand by breakfast? What is the time? It is a time restricted diet, right? I mean, when I say what time will you have your breakfast? Tell me, is it 9 o'clock or 5 o'clock in the evening?
Morning between
Morning.
7:30 to 8 a.m.
38, 9 o'clock. Lunch, if I say when you'll have your lunch at 7 o'clock in the morning or 12 to 2 o'clock,
1 p.m.
1 p.m. So what happens is, if say for example, now it's 9 o'clock, I say, well, let's have breakfast. It's 1 p.m., let's have lunch. If it is say 7 p.m., we say let's have dinner. We don't have this concept. We say whenever you are hungry, you have your meal. So my meal, most of the time, it is at 12 o'clock. I don't know what it is. Like it is a breakfast or lunch or brunch. I don't know. I have my first meal at 12 o'clock most of the time. Somebody can feel hungry at 1 o'clock in the afternoon. So your first meal will be at 1 o'clock. It is not a breakfast, it is not a lunch, it is not a dinner. Your first meal will be at 1 o'clock. And then if you feel hungry again at 7 o'clock or 8 o'clock in the evening, have your meal. And say whole day if you're not hungry, don't eat. You don't need to eat. Okay, you don't need. Just one more thing. If you don't eat medicine also. Many people, they uh, just to take medicine, they take food because their doctor has said this drug has to be taken after food. So they are not hungry, but they need to take the medicine because their doctor said you need to continue with the medicine. Don't skip your medicine. So they don't want to skip the medicine. So they take food. Okay. So they take food which they are not supposed to take because they are not hungry. Just to take medicine, they take food. What we tell is, if you're not hungry, don't eat and don't take your medicine also. Because if you're not hungry and you are not eating, then you don't need the medicine. You skip your medicine. Simple as that. And this is how you stop your medicine. This is how you reverse your diabetes. And we in DIAAFIT, we will provide you with uh, those food items. After eating those, your hunger will go down. Your hunger will be suppressed. Okay, but the other organization, they will give you those food items like idli, dosa, poha, upma, dalia, and after eating all those things, you will feel hungry again, and that's why you will eat more and more. The more you eat, your calories will be high, carbohydrate content will be high, and you will never be able to reverse your diabetes. And that's why you see for 10 years you are diabetic. For 10 years, I was diabetic for only 1 year. I reversed my diabetes, and those people who join our program, they reverse their diabetes within a year if they are newly diagnosed. If you have diabetes for 10 years, 15 years, it will take longer time. So please take action. If you are diagnosed with diabetes, take action immediately. If you have diabetes for 10 years, 15 years, it will take more time, maybe 2 years, 3 years time to reverse your diabetes. So please take action if you have diabetes right away, right now. Okay. Did I answer the question? See, I am explaining all these things because I can answer the question in yes, no, and in very few seconds. Like, what was the question, Navnita?
The person doesn't feel hungry, wants to eat less
So I'll say
during
it's okay.
summer. During
So I'll say
summer.
I could, my answer could have been just okay. That's fine. But I have to explain. If I don't explain, then you will not understand. Okay, I think we got one question. Let me take this. Sir, my fasting blood sugar stays around 120. After breakfast, my blood sugar remains around normal levels. However, after dinner, 6 p.m., my blood sugar rises to 170. Why does this? Mr. Sankalp, or whatever your name is, firstly, you need to understand what is normal. Because if you don't understand what is normal, then you will always have confusion like this. I have 1,000 times said this and again repeating myself. Please understand what is normal blood sugar. If you don't understand, you will ask this type of question. You are not watching my videos, and that's why you are asking this question. I'm repeating again. Please watch all my videos. And I've said 1,000 times, more than 1,000 times, what is normal blood sugar? Time in range. Time in range. Please understand time in range. Again, put in your mind time in range. And I'm telling you one thing. This time in range will within 5 years. This time in range will be followed will be written in the guidelines, and it will be followed by all doctors worldwide, not only in India, worldwide. Mark my words. Within 5 years, every single doctor will talk about time in range. I have said this much before also, earlier also, and I'm repeating myself. Time in range is what is important. There are several studies which shows that you need to focus only on time in range. Not this is the normal. Time in range means 70 to 180. 70 to 180. I can see that 120 is also normal and 170 is also normal. Just because your definition is not correct, and that's why you are getting uh, anxious and this, okay, depressed or whatever. So, time in range. Please mark my words. In 5 years, all the guidelines will only talk about time in range. All doctors will talk about time in range. Okay. It means 70 to 180 is normal blood sugar. Below 70, we call it hypoglycemia. And more than 180 is hyperglycemia. So, it is not a good thing to be in hypoglycemic state or in hyperglycemic state. You need to keep your blood sugar, be it fasting or pp or random blood sugar, within that range. And I can see that your blood sugar is, even in the morning, is 120. After uh, uh, say after dinner it's 170, which is normal. Okay, so please understand what is normal first. You don't have to keep your blood sugar below 100 for fasting. You don't have to keep your blood sugar below 140 for to be normal. Simple as that. Please comment yes if you understood correctly, Mr. Sankal. Type yes if you have understood. Okay. Any other question? Okay. How people are able to ask the question? See, Mr. Sankalp is a member of this channel. That's why he is asking. If you're not a member of this channel, please be a member of this channel, and then you will be able to ask me questions. Okay. This much you can do. This much you can do at least. Okay, see, whoever is a member, they can ask. If you're not if you can't be a member, forget about diabetes reversal. If you can't spend 500 rupees to be a member of this channel and you're thinking of diabetes reversal, forget it. Forget it. You need to invest some money. You need to do something for your diabetes reversal. Everything cannot be free, because when you want everything for free, you are not accountable. You don't take any thing very seriously. Yeah, you agree with me, Navnita? If everything is for free, people don't
Yes,
take serious.
doctor. Yes.
Yeah, everything should not be free, right? And this is it's less than a pizza. To be a member of this channel is less than a pizza. A pizza costs 600, 700 rupees. Okay, being a member, you can ask good questions. I address all the questions asked by the members. Okay. Okay, Sankalp has said yes. So now I hope your stress is relieved. Don't take stress. Take stress only if your sugar level is more. Even then, don't take stress. You can reduce it. Follow DIAAFIT diet, exercise, have proper sleep. Okay. Any other question?
Dr. Sheena is asking, what is macrovascular damage and microvascular damage?
So this is not required for them. This is very high level question. Okay.
Yes,
These
doctor.
are all, so I don't think this is, don't go into such detail because these are only for medical students. If I talk, none of the people will understand what is macrovascular and what is microvascular. Okay. So it's not required. Okay. Any other question?
I'm allergic to whey protein. What are the other substitute of proteins?
Okay, so if you're see, if you're taking whey protein, which means you need a supplement. Okay, you are taking a supplement. So whey is like a animal protein, you can say, because it is derived uh, from milk. So in that case, you can take plant protein. Okay, if you're allergic to whey protein, you can take plant protein because you are asking about whey protein means you are taking supplement. Okay, that's why I said instead of this supplement, you can take a plant protein, plant-based protein supplement. Okay, anything else?
How often, this is from Mr. John, how often do I have to visit my doctor to check is my diabetes reversed? And how often should I do my blood test?
So blood test you need to do very frequently if you're diabetic on a daily basis. If you're pre-diabetic, weekly at least once or twice, and if you're non-diabetic, then monthly once or twice is fine. But I recommend if you're diabetic, please uh, do a quarterly HB1C if you have diabetes, if your HB1C is more than 6.5. If you're in the pre-diabetic range, then there is a high chance that you can be diabetic. So every 6 months, you need to get your HB1C done. And if you don't have diabetes, if you don't have pre-diabetes, then at least once in a year, you should get your HB1C checked so that you don't get a shock. Finally, your HB1C might be 10, 15, you are not checking. So every year, if you check, if you're a healthy person, you'll not get a shock. Okay. If you're a pre-diabetic, if you don't want to get a shock, then do it every 6 months, HB1C, that's it. And for diabetic patients, every 3 months should be done, HB1C test. Anything else?
Can I go to gym regularly or shall I go alternate days? This question is from Sahil.
So it depends on individual to individual. What is your goal? It depends on age. So 3 days is good enough. Every alternate day is good enough. But if you can go 5 days, 6 days is also good enough. So it depends on individual to individual. Mind you, you need rest as well. At least one day in a week, rest is mandatory because every single day, if you do exercise and your body is not getting enough rest, then you can have problem. You can have severe problem. Okay, so it's better to take rest in between. Okay, if you are say 40 plus 50 plus have never done strength training in your lifetime, then go slow. Slow but steady wins the race. Slow but steady wins the race. So take a break one day, go to gym, then take a break, then another day, and slowly and gradually, when you become more professional, more active, then 4 days a week, 5 days a week, 6 days a week also you can do. But one day of rest is very important. Now, if you ask me, I work out every single day. I can do 7 days a week because I know. Uh, so there are different exercises which you can do, and next day those muscles will get relaxed. So you can target one particular muscle one day and don't do any exercise for that particular muscle for the next 2 days, then it will get relaxed. Okay, so this is the technique This is something which is very advanced level. For a very beginner, for a beginner, you can 3 days is enough. And slowly and gradually, when you advance, when you are more professional, you can 5 to 6 times a day also. Clear? Anything else?
Can I stop sugar craving? What are the options?
So for sugar craving, every individual will have different options. I would recommend that you join our coaching program. We help you what food intake. But if you don't want to join, that's also okay. Eat more of protein. Eat more of protein. Do exercise. Drink more water. And if you still feel craving of sugar, then you can eat some kind of fruits. That's it. That's it. Or eat dark chocolate. Eat dark chocolate. I recommend 95% dark chocolate. Once you have that bitter taste, and slowly and gradually you'll forget eating chocolate at all. You'll not have the craving at all. This is my personal experience. Okay, if you're watching live, please give a thumbs up, heart, like, whatever. You might be watching from Facebook, LinkedIn, or YouTube, wherever. Give a like. This gives us a motivation, and this also helps the video to reach more people, so that people can benefit from the insights which we are sharing on a daily basis. Anything else?
I'm looking for the question. Just a minute.
Okay, let's wind up today. I think we already had 47 minutes. I think we'll come live once again tomorrow. Let's keep those questions for tomorrow. Okay.
Yes,
So
doctor.
thank you so much, Navnita, for taking all the
Thank you,
questions.
doctor. Thank
Yeah,
you.
diabetes is not a chronic disorder. Diabetes is a dietary disorder, and it can be reversed through lifestyle modification. I have made thousands of videos. Please watch all my videos, and those videos will help you to reverse your diabetes. However, if you cannot reverse your diabetes on your own, you are most welcome to join our coaching program, and we will help you to lead a medicine free life. The way I am leading a medicine free life, you too can lead a medicine free life. Call at the below mentioned number or at the top if you're watching through portrait mode, and we'll be happy to help you. Thank you so much. Bye bye. Take care. Good night.
Thank you.